Melatonin is a hormone naturally produced in the body that regulates sleep. When taken as a supplement, it is commonly used to treat sleep disorders, jet lag, and other sleep-related issues. Like any other substance, melatonin can cause side effects. Some of the most common side effects include 1. Drowsiness and fatigue. Melatonin is a sleep-inducing hormone, so it's not surprising that drowsiness and fatigue are common side effects. It's important to avoid operating heavy machinery or driving after taking melatonin. 2. Headaches. Some people may experience headaches after taking melatonin. This can be due to the supplement interfering with natural hormonal balances. 3. Nausea. Nausea is another common side effect of melatonin. This can be due to the sudden change in the body's natural balance of hormones. 4. Dizziness. Melatonin can cause dizziness in some individuals. This can be due to the drowsiness and fatigue that often accompany melatonin use. 5. Depression. In some rare cases, melatonin has been linked to depression. This may be due to a disruption in the body's natural hormonal balance. 6. Irritability and anxiety. Melatonin can cause irritability and anxiety in some people, especially if taken in high doses. 7. Stomach cramps and diarrhea. Some people may experience stomach cramps and diarrhea after taking melatonin, which can be due to the supplement irritating the digestive system. It's important to note that these side effects are not experienced by everyone who takes melatonin. Additionally, the severity of these side effects can vary depending on factors such as the individual's age, health, and the dose taken. If you are experiencing side effects from melatonin or any other supplement, it's important to speak with your doctor. They can help you determine the cause of the side effects and the best course of action. It is also worth noting that melatonin can interact with other medications, including antidepressants, birth control pills, and blood pressure medication. If you are taking any prescription medications, it's important to speak with your doctor before taking melatonin to avoid any potential interactions. In addition, people with certain medical conditions, such as liver or kidney disease, should not take melatonin without first consulting with a doctor. Pregnant or breastfeeding women should also avoid using melatonin, as its safety in these populations has not been established. While melatonin is generally considered safe when taken in recommended doses, it is still important to be cautious and aware of its potential side effects. It is also important to use melatonin as directed and not to exceed the recommended dose, as this can increase the risk of side effects. In conclusion, while melatonin can be effective in promoting sleep, it is important to be aware of its potential side effects and to speak with your doctor before taking it, especially if you are taking other medications or have a medical condition. It's also important to note that melatonin supplements are not regulated by the Food and Drug Administration, FDA, in the same way that medications are. This means that the quality and potency of melatonin supplements can vary greatly, and the amount of melatonin listed on the label may not be accurate. It's important to purchase melatonin from a reputable source and to follow the recommended dose. Additionally, while melatonin can be helpful for some people with sleep issues, it is not a long-term solution and should not be used as a substitute for healthy sleep habits, such as maintaining a consistent sleep schedule and creating a sleep-conducive environment. In some cases, the underlying cause of sleep problems may be related to a medical or psychological condition, such as sleep apnea, depression, or anxiety. In these cases, melatonin may provide temporary relief but should not be used as a substitute for proper medical treatment. Finally, it's important to remember that everyone is different, and what works for one person may not work for another. If you are having trouble sleeping, it's important to speak with your doctor to determine the best course of action for your individual needs.